All right, well, everyone, welcome. I've been watching people add in, and it seems to have flatlined out for the moment. Welcome, everyone, to the Ohio Health Modernization Movement's monthly webinar. Today's webinar is Interfaith Wisdom from the AIDS Pandemic for the Age of COVID-19. And if you're unfamiliar with the Ohio Health Modernization Movement, we are a coalition working to modernize the criminal code around sharing your HIV status with an intimate partner. Couple of things as we start our webinar. We're going to use the chat feature for questions. So not the raising the hand feature, but the chat feature. You can just type your questions there and I'll be able to see them, as will Heidi. And I will just let you know that if you are interested in some of our previous webinars, I will put the link to that in the chat in a moment, and just announce that our October 13th webinar will be When They See Us, Developing a Race Equity Lens with our own Bryan Jones, who you can see in front of you, who will be coming back in October for that. And I will now turn it over to Heidi, and I'll put that link up in the chat. Heidi?
Well, welcome everyone. I'm Heidi Weaver-Smith. I'm the Executive Director and founder of LOVEboldly, where we do reconciliation work between the church and the LGBTQ plus community. So I'm very eager and excited to hear from the stories today, as I know all of you are. So thank you for joining us for this story sharing webinar to look at the ways that the AIDS pandemic unfolded, and to hear and learn from the stories of those who have lived, are living through it, and to learn from our collective wisdom together. Our hope today is to listen and learn lessons that we can take into this current age of coronavirus for the benefit of all who encounter disproportionate risk and stigma today. So our three panelist teams will share their stories, their observations, reflections, insights today on our key questions. And the key questions we'll be exploring today are: how can people of faith be among those who show up in ways that help rather than hurt? And what wisdom can we learn from the stories of those who have been at the center of the AIDS pandemic as the COVID-19 pandemic unfolds today? So each of our dyads is going to chat together for about 20 minutes, swapping stories, sharing insights before a little chime will go off, and then we will move to a time of Q&A after each of our three dyads has shared with us today. So we'll hear from them for about an hour and then have some Q&A there at the end. Great. Well, I would love to, with that, introduce our first two panelists. Reverend Michael Shinnemeyer has served as Executive Director for the United Church of Christ HIV and AIDS Network since 2002, providing leadership in HIV prevention education, comprehensive sexuality education, and advocacy for increased faith engagement in the HIV response. He's the founding chairperson of the U.S. HIV and AIDS Faith Coalition, and he serves on the HIV Strategy Group of the World Council of Churches Ecumenical Advocacy Alliance. With him today is Vanessa Johnson, the co-founder of Ribbon Consulting Group, whose mission is to improve community and resident health, especially for individuals with hidden disabilities and chronic health conditions, including those living with HIV. So we have much to learn from Bryan and Vanessa. Welcome, you two.
Thank you. Thank you, Heidi, and thank you, Kim. And hello, Vanessa. How are you doing?
I'm fine. How are you, Reverend Mike?
I'm doing well. It's great to be with you, and welcome to everyone who's part of the webinar today. So I know for myself, I first became involved in the HIV response back in the mid-1980s as a new pastor. Began serving in a local congregation in 1984 in San Bernardino, California. And we got a call from the local MCC pastor who gathered a group of other mostly Christian pastors, and there were a couple of Jewish leaders who also participated to think about how we might be providing pastoral and care support, because so many people at that time who were living with HIV were actually placed in AIDS wards and hospitals, were experiencing a lot of isolation. Their families, their loved ones, their partners, folks were not coming to see them. Even the people who were providing healthcare were really social distancing from them in a serious way, sliding their food through the door. And it was really a horrible, isolating experience for that. I know a lot has changed since then, as people got to know more about the epidemic and learn more about it, people began to realize that it was possible to be present with people. You didn't have to deal with worrying about becoming affected by HIV or acquiring the disease yourself. But some of those old things just kind of held on because it kind of became part of people's DNA, where that fear of being in contact with people who might be sick and the way in which we deal with health anyway was always somewhat kind of stigmatizing for folks. And I have found, as I've continued to work in HIV, that people still experience isolation. There are still things that are present in our own way in which we have our criminal code is set up that is stigmatizing. People are sometimes hesitant to go encounter a health care provider because they're afraid of how they might be treated. And Vanessa, I know that there was just a few years ago, well, maybe about 10 years, actually more than a few years ago, folks with the Global Network of People Living with HIV, the Women's Network, and UNAIDS worked together on creating this, what's called the Stigma Index, to measure how people experience HIV-related stigma. And I know you've been involved in that, and I wonder if you'd share with us something about your experience with that and what the evidence is kind of showing us about how people might be experiencing stigma today.
Oh, that's really good. Thank you. Thank you. I will do the best I can. Just a little bit about myself and how I got involved with the Stigma Index Project is that I am a woman living with HIV, have been since 1990, which is about 30 years, and got involved because my early experiences with my diagnosis were not good. I mean, at that time, I think Reverend Mike said it very well, it was shrouded in fear. That's all anybody could think about when they heard the word AIDS. It was equated with death, and so people ran. And unfortunately, our government did not respond as well as it should. It's a similar response to what we're experiencing with COVID, is that probably due to the stigmatization of people who were exposed or susceptible to HIV and now COVID, that we didn't respond well as a government and as a nation, and we're facing the same difficulties today. So I got involved because of the stigma. I myself for 4 years would not really share my status outside my family, my friends, and my healthcare providers. And I realized when I went into a recovery program for substance use, my counselor was saying that if I didn't deal with this, I was not going to live long. And at that time, it was a death sentence anyway. And so they got me involved with a faith-based retreat, by the way. It was an excellent retreat. It was exactly what I needed. And there I realized I had to free myself. And in realizing I had to free myself, I needed to free others who were trapped in that stigmatization of HIV. And so, long story short, moving fast forward, we come to the people living with HIV Stigma Index. And as Reverend Mike said, that's the global network of people with AIDS who started that. And it's in partnership with the Joint United Nations Program on HIV and AIDS and the International Community of Women Living with HIV. And so it serves two purposes. It serves to serve as a comprehensive data collection effort that's led by people living with HIV. Now, the Stigma Index Project is a collaboration with a whole bunch of people, but the primary movers of this Stigma Index Project are people living with HIV, and they go and they collect the data from other people living with HIV, which gives an estimate of the amount of stigma that people living with HIV are contending with in a particular community. And then from there, we use that data, Mike, to make decisions about how we're going to tackle stigma. Is there anything else you'd like me to add on to at that point, other than to give you a little bit of results that may share some light on how people living with HIV view faith institutions?
Yeah,
Well,
I think.
Go ahead.
Yeah, I think hearing a little bit about, that, particularly since one of our contexts for today's conversation is faith, that it would be great to kind of maybe have a faith lens or some of the data that you've received and what the story of some of that is. And thinking about that, I just thought that maybe I would share a little bit about some of the characteristics of stigma, right? Because there are at least kind of 4 areas in which people might experience stigma. There's internal stigma, in which people kind of turn harmful judgments on themselves. There's that anticipated stigma, in which people perceive the fear and expectation of mistreatment and discrimination. There's what might be called external stigma, which is the result of an actual judgment or mistreatment and discrimination of someone who experiences something actually enacted towards them. And then there's a structural piece, right? It's the laws, the policies, or regulations that have a discriminatory or stigmatizing effect. And so as you share that, people might be thinking about, well, how do I perceive how this stigma is working in the context that I'm in?
Okay. I think it was great to have those descriptors of what stigma is, because it's really important to be as precise as we can when we're talking about stigma. And so the stigma index looks at those 4 areas, looking at demographics, experiences with stigma, discrimination, and advocacy, and experiences with testing, disclosure, and access to services. And so what the results from those 4 areas and the 4 types of stigma that Reverend Mike referenced have indicated that in terms of external stigma, 15% of people living with HIV deliberately withdrew from faith-based organizations as a protective measure. And that a lot of that was talked about in the beginning when we started our introduction to this session, has to do with rejection, and then people isolating for fear of rejection. In terms of awareness, the nice thing about this, even though some people shy away from faith-based institutions because of the fear of stigma, the nice thing about the results is it indicates a higher amount, 25% actually perceive faith-based organizations as source of support that they can go to. So that was nice. What do you think, Reverend Mike? What do you think?
Yeah, well, I think that's helpful information, because it gives us a sense that we're not just talking about things that are anecdotal, right? We're talking about things that people actually really experience, unfortunately. And so I know you and I have been working together on a project called the Framework for Dialogue, which engages people living with HIV and faith leaders in a dialogue designed to create joint actions to reduce and eliminate stigma. And so I wonder if you might share with us some of your impressions of the work that you've done. We've been working in Detroit metro area and also in Baton Rouge and New Orleans. And of course, our thoughts and prayers are with them as they experience Hurricane Sally coming through. Many of the people we're working with have evacuated from that city, from those areas in order to get safety. But I thought maybe you could share a little bit about some of your experience with the Framework for Dialogue.
My experiences overall have been very encouraged. I've been very encouraged from my experiences. I have had the opportunity to work with Reverend Mike and the individual who serves as our primary staff person for the project, Arthur Butler, as well as the team he has put together with Jacqueline Coleman and some other folks, and have worked extensively in Detroit with them in helping organize and mobilize our community, the faith community, the people living with HIV community, and the general community of folks who are interested in volunteering, that want to give back to their communities. And It has been an enlightening process. It's been a very exhilarating process in the sense that when we first got together, and it took us about 2 or 3 times until we hit our stride, where everybody in the room could give their perspectives, listen to each other, and develop a game plan as to how we're going to move forward. And I say that because it wasn't that everybody left the room with the same mindset. Some folks may have reinforced what they thought when they came in the room. But what I will say, there was a shift towards trying to work together. And that's really important. As long as we stay in communication and move forward in terms of trying to tackle this stigma, I think that it's a worthwhile project. And for those of you who are interested in working with faith-based organizations and other groups of people who truly need spirituality at this time, in whatever form that we can get that in, I encourage you to seek out information about the framework for dialogue.
Vanessa, a couple of years ago, I remember at the International Stigma Conference, you shared some visions about what you hope that faith communities might do, becoming more welcoming places, for example. And I wonder if you might share some of your thoughts, your wisdom about that, and maybe, you know, how you connect this to what's important as we seek to address COVID-19 as well.
Yeah, thank you. It goes without saying that the faith-based organizations, faith-based institutions, churches, whatever term you want to use, are the cornerstones of many of our communities. And so when people are in need of help, that is one of the places that we turn to. Also, the leadership that the faith community has shown through all the trials and tribulations of Black people living in the United States, whether that be as Underground Railroad or civil rights, all the way up to now we have Reverend Barber in North Carolina with the Poor People's Movement, Poor People's Campaign. He has resurrected that campaign. I mean, there's such leadership in the community. How could we not call upon the faith community to continue the good works they have done? So for me, while I am not part of a home church or part of an organized religion, I do practice spirituality, and I know that at times that is a group of resources that I can call upon when needed. In terms of stigma in my own life, I got a lot of redemption when I started working with Arthur Butler. He served as executive director for the Capital District African American Coalition on AIDS. And during that time, we formed a program called Open Your Heart. And so our premise is we just want to, same as Framework for Dialogue, create a space where people can come together and talk about their differences and similarities and forge a map for moving forward on this journey we call life. I don't know if that answered your question directly, because sure. I don't really recall what I said.
No. I was just trying to use that as a way for you to share what you shared.
But that's what I feel about the Framework for Dialogue. I just think it's a great tool. And
well, the thing I really like about what you're talking about, Vanessa, is that you talk about in ways that really helps to center the voices of people with lived experience.
Yeah.
And that's what the Framework for Dialogue also seeks to do, right? This is not a place where we invite pastors to come and say, this is what we're doing. We ask pastors to come and faith leaders to come and listen to people who are living with HIV, to listen to the evidence that shows about what people experience in terms of stigma. Mm-hmm. And then to ask the question, what do we want to do about it together? How can we reduce and eliminate stigma together? A few years ago, when the GAP report was put out by UNAIDS, it's a 460-page document, and there were about 450 references to stigma. There were 3 or 4 references to the faith community. Yeah. And we know intuitively that religion has played a role in the way in which stigma has proliferated. It can also play a role, and in many places it does play a role, in ways that reduce and eliminate stigma. And I think the stories that we're going to hear from some of the other folks who are on the panel today are also going to help us understand this more deeply and how we can move forward and be more effective in the work that we do as community leaders, as faith leaders, to be more effective in reducing and eliminating stigma and addressing the real key issues that are going to help us to address the HIV epidemic effectively going forward. And so, Heidi, I'm going to turn it back over to you so that the others can engage in the conversation going forward. Thank you.
Thank you, Reverend Mike. Thanks.
Thank you, Reverend Mike and Vanessa. That was so illuminating. I appreciate you sharing your stories and perspectives. Our next two panelists are Bryan C. Jones and Khadijah Abdullah. Bryan C. Jones has been thriving with AIDS for over 37 years and has been an advocate and activist for about half that time. They are the National Founding Steering Committee member of the International Undetectable Equals Untransmittable campaign. And Bryan was instrumental in the forming of the Ohio Health Modernization Movement, whose mission is to modernize HIV non-disclosure laws in Ohio. Bryan is the proud recipient of the Equitas Health 2016 Midwestern Trailblazer Award for their lifelong commitment to the LGBTQ community and HIV/AIDS, and the Equitas Health 2016 Midwestern Community Advocate Award. Joining Bryan today is Khadijah Abdullah. Khadijah is the founder of Rahma, Reaching All HIV-Positive Muslims in America, a nonprofit that addresses HIV, female genital mutilation, sexual health, and gender-based violence in faith communities through education, advocacy, and empowerment. She's also the founder of the National Faith, HIV, and AIDS Awareness Day. So welcome, Bryan and Khadijah.
Assalamu alaikum.
Wa alaikum assalam. Thank you, Heidi and Kim, for having us on this webinar. And Bryan, hey, Bryan.
Hey, what's going on? Here we go again.
I know, right? So also, Bryan is one of our board directors of Rahma as well. He just joined our board in August, so we're so happy to have him here. He's also a very integral part of Rahma, leading some of our programs at like our retreats, speaking out in masjids in front of a lot of people about HIV and AIDS, and helping to raise awareness and address stigma. So just to get a quick background about Rahma. Rahma means mercy in Arabic, and our goal is to do our work through the principle of mercy and compassion. As we know, HIV is a very stigmatizing topic, and in our community is very stigmatizing as well. I started Rahma because when I was in college, I was studying to be a student nurse, and I was working at a hospital part-time, and I met a Muslim man living with AIDS. He had progressed to the AIDS stage. And he was telling me, you know, how he didn't feel welcome in his community, the stigma he faced, and he just couldn't go back. And it kind of opened my eyes to the stigma. Like in our community, we probably talk about sexual health, so forget HIV or AIDS. So it kind of pushed me to start Rahma and to raise awareness. And now Bryan, I know he knows very well, unfortunately, about stigma and, you know, what that happens in our community. So Bryan, tell us more about stigma, issues you have faced, and how we can, as a community, be more supportive.
Well, I think I want to preface it with stigma. For me, stigma exists in everything. It exists in being too black, too dark, too light, too tall. So stigma is everywhere. But as it relates to our faith community, and we have stigma in the interfaith situation among each faith, because usually or normally when you hear these faith conversations, they're typically dealing with the Christian faith.
Right.
And I think we have to change what that looks like too. When we say faith, we should be inclusive of all faiths, which we're doing today, which is great. And it is not that a lot of spaces don't try to be inclusive, but for some reason, they only seem to be able to find one Muslim somewhere.
Yeah.
Or no Jewish person, or no any of the other faiths, no one else. So the conversation typically ends up being like speaking to the talking to the choir, so to speak.
Right.
So, but as it relates to Islam specifically, I've heard and I have witnessed stigma and have experienced personally of not being able to pray on the same prayer rug as somebody, not being invited to pray next to someone, not being invited to pray in the mosque, not being invited to pray in congregation. In Islam, there are multiple benefits and blessings from being able to pray in congregation. Not wanting to be allowed in the space to cleanse yourself with everybody. So it's so many things that impact not just your faith perspective, but who you are as a person. People not wanting you to use the restroom to cleanse yourself for salah, or we know that we pray barefooted. No one, oh no, you can't. We can't have you barefooted in our house. I have seen people spray with Lysol. So stigma exists in so many other ways where it not just impacts who you are, it impacts your self-esteem as a person and how you live. So on a personal note, for myself, I had to decide whether I wanted to live or die. And if I wanted to live, I had to pull myself away from a faith community. I lived in the community specifically with my sister and them at one time in Michigan. And I couldn't take my medication. It just got to be so bad. But besides the faith portion of the stigma, I didn't want people to see me die this ugly death. That ugly death back then in the 80s was just too much to bear. You know, I'm college educated. I decided to go to prison and die. And I felt like that would be the best way, because then I wouldn't have to tell people about it. I had been taking care of people who had a great diagnosis at that time, AIDS diagnosis, and watched them die. And I said, oh no, I can't do this. And even those people I was taking care of, I never told them I had an AIDS diagnosis at the time. And I never told myself in a room by myself that I had an AIDS diagnosis. That's how heavy the stigma was. So anyway, to make a long story short, I decided to go to prison to die. And after having cancer 3 times and being chained to a prison bed with stage 4 cancer, you know, I said, Allah, this is not funny. You know, you won't let me go. And the only way I got back into my faith was I went to a national conference on AIDS and saw a workshop in the program that said HIV positive, Muslim, and same gender loving. And I was like, what? The room was so crowded, you couldn't even get into the hallway to get to the room of the room by the room. Mm-hmm. That's how many people were there. And when I got there, I realized, wow, I could be Muslim and still be HIV positive and same gender loving. Go. I'm sorry. I get going. You have to jump in.
I want you to speak your truth. I want to hear from you. So so good. But I think to piggyback off what you were saying, one of my experiences with stigma is one of our attendees, they went to the mosque, or the place to worship, the masjid, during Ramadan, which is our month of worship where we fast from sunrise to sunset. And he at the masjid and helping to serve food to Muslims who are breaking their fast. And someone knew he was HIV positive. And they disclosed his status, and people started whispering about it, and they refused to take food from him because they were afraid that if they touched the same spoon he touched, they would become positive. And that's a really strong example of stigma. And it's like, that was back in early 2000s they were telling me about. So it's like, this is still happening in our community. And you mentioned, right, when we have these gatherings, it's mostly heavily Christian focused, not really interfaith, more like intrafaith, right? So when we started Rahma, we were focusing only on the Muslim community, but then we realized, you know what, we need to do more than that. Like, it's expands beyond our community. So it pushed us to start Faith HIV/AIDS Awareness Day as well, and trying to bring together all these different faith communities. And I know you were a part of that also. I know you led the initiative out in Ohio. So what was how was that experience for you, bringing together all these different faiths and seeing that as a true interfaith gathering?
I think getting people to participate was great from different faiths, but the public at large, it's hard to bring different faiths together at large for various reasons, because then it becomes a meeting about dogma. You know, this is this and that's that, and you know, and people want to say, well, how can you be Muslim and be gay the same way you can be Christian and be gay, or be Buddhist and gay? It's not about the faith portion, and we're not here to talk about our differences. If we start to talk about our commonalities, we will realize that we're more alike than we are different. And sometimes we have got to move ourself, our personal self, out of the equation and deal with us all as being humans. And it's not about who you sleep with or who you choose to love, because love is love. And like the organization LOVEboldly, you should be allowed to love boldly. And it shouldn't make a difference in who you are and because the essence of faith is all about social justice and accountability, doing the right thing. Whom I love shouldn't be a part of me doing good works and helping people. So.
Okay, so I guess the question I have for you, and I'm leaving questions for me, I'm asking the questions. I know you do. But
In a minute, so
what'd you say?
questions for you, but sometimes you'll shut me down. So
I ain't gonna shut you down, Bryan.
when I first met you, I met you at a congressional briefing. What was it, 13 or 14, 2013 or 14?
Something like that. It probably was
And, you know, naturally, when you're sitting somewhere speaking from a Muslim perspective, your attention is drawn to the hijab in the room. You know, like, what is she here? Wow. You know, and a sister too, you know, and we talked afterwards, and I was so impressed that a Muslim sister would, and when I mean sister, I don't necessarily mean black. I mean sister in, you know, faith, was doing this work, because it's such a misogynistic standpoint of how people in faith move. And it's not just in the Islamic faith too. You know, I do know that when it comes to leadership position, but here you were standing proud. So what made you do this, and how, and because I'm sure you had to fight through your own stigma, especially doing the work of HIV. So how did you fight through that stigma?
Well, actually, when I was in high school, we had a man come, and he was positive, and he spoke to our homeroom class. And I felt so disgusted by him. I was like, why is he here? Why is he here? I like it here. I like it here. I like, if I didn't become positive myself. It's kind of the stigma that I had. I was like, I didn't want to stay in the same room as him. And it wasn't until that one of my close friends became positive at 19 years old, and meeting the man living with AIDS in the hospital kind of made me think, okay, wait a minute. I'm perpetuating stigma myself. I am part of this stigma cycle that's going around and around and around and around. And I need to address my own stigmas and learn more about HIV and AIDS, and learn about it. And then I kind of did that, and went to my college campus and kind of organized a whole week of awareness on HIV and AIDS. And then I learned so much about it that week. I found that it was something I was passionate about, and I really wanted to do it. So that started my journey in this field. And then when I started Rahma, you know, misogynistic, here's where it comes in. There was a faith leader. He was like, you shouldn't be leading this organization because you're a woman. I'm like, what does that mean because I'm a woman? I can't lead something because I'm a woman. I don't have the same kind of ability as a man. And like, we had this conversation about it. And I was like, I'm able to be part of this organization. You know, if no one else is doing it right now, so I can't accept them do it. It's a need. It shouldn't matter if you're male or if you're female and you're doing the work. The point is, are you doing the work, right? So alhamdulillah, our board is very diverse, males, females, they and them, and we really try hard to kind of address the stigma. And I mean, every day I'm continuously learning. I'm learning from you and everyone else part of Rahma, even the outside world, it's not part of Rahma. And I'm still facing stigmas, like things I'm learning, like, oh wow, why did I think about that like this? Why did I say that word? Language matters. You know, I have to always address my own stigma as I grow, because it's very, very important. Because if I don't do that, then I can't really do this work. So it all started back when I was in college back in 2009. And, you know, I kind of realized that I need to learn about HIV and AIDS, and I changed my whole major from student nursing to public health to kind of do this work. So, yeah.
Well, I do know a personal experience. Oh, I got a feedback. I don't know. A personal experience that we shared was when this past year, when we were in DC for a Rahma meeting, and we went to the mosque on that Friday, and we were to speak. But as you know, the women pray. Well, you may not know. They pray in separate spaces. Usually the women are behind the men for various reasons. Yeah, and you couldn't, the mosque was packed and you couldn't get there. Me and you were going to talk about testing. It might have been, it was around Faith HIV and AIDS Awareness Day, I think, if I'm not mistaken. But we were going to talk about the mission of Rahma briefly and about HIV and AIDS, and we were doing testing, but you couldn't get to the front. So the imam handed me the mic and I started talking. And when he was talking prior to that, you know, they want to come and talk briefly about HIV and AIDS. It was after prayer, after service. People, when they heard HIV and AIDS, they got up. And en masse, they moved towards the door, and he handed me the mic. And I said, well, I'm a person who has been thriving with AIDS for 37 years. You literally could see people stop in their tracks and turn around and come back in and listen. So we are making some headways, but I think that's a testament to how important it is for people living with HIV and AIDS to be at the forefront, to give these people a real life, a real situation, a real journey to attach HIV and AIDS to. Because for us in the Islamic community, many people feel that Islam, when it comes to Islam, HIV and AIDS doesn't penetrate that. And for some reason, if you do contract HIV and AIDS, that you're doing something un-Islamic to become a Muslim. So I said the bottom line is, all of our mothers had unprotected sex, or none of us would be here.
Right?
So you run the risk of possibly contracting something. And sometimes a lot of people mix the culture, a culture with the faith. And many people who experience Islam, many people who experience Islam think that it's all about having multiple wives and that kind of thing. There's certain circumstances that would have blessings in that. But there's certain circumstances, not just because we want to have sex, but people do have sex. Young people, old people, Muslims who may take a second wife for a very good reason. It's still sex. So sometimes people realize that you have multiple sex partners. Anytime you lay down with somebody, there's more than two people in the room, because you're laying down with the history of the person you're sleeping with, and also your history is brought into the room. So I think we have to stop looking at it and sex shaming people. And in Islam, we've got to have more open and candid conversations about sex, because we do understand within the faith there is a reason for procreation and sex. We're not anti-sex. We're just anti your sex and putting your sex out there and how you're having sex and why and that whole thing.
So piggybacking off of that, so how can we move forward? I know you and I are doing things together, Rahma, for the past, 4 or 5 years, but people who are out there, who are listening to us have our conversation, maybe even Muslim, who knows, how can they move forward in supporting people from different faith communities and addressing stigma in our faith communities? So what are your thoughts about that?
I think we've got to stop letting our doctrine put up these borders and barriers, because there's only one God. No matter how you call them or how you worship him, there's only one God. And we are not to, example of Islamic history, at one time the Muslims and Prophet Muhammad sallallahu alaihi wasallam, peace and blessings be upon him, allowed the Christians to seek refuge in Medina and protected them, allowed them to pray in their own church, respected their church, and that kind of thing. So there is respect in faith. A lot of people have this misconception about Islam, about, oh, it's all about the sword, killing people. And there's a religious zealots in any faith that you can find. There are people who take everything to the max. Like I said, if we work on our commonalities, but we've also got to understand that I didn't know that there were communities and mosques of, to use the same phrase as Christians, the open and affirming community. There are mosques where women lead the congregational prayer, they give khutbahs, which is the message. So it does exist, but collectively we have to do better. And I think it takes people like myself who are same gender loving, which many may say gay, and being Muslim and showing up and saying I'm Muslim, and sometimes that you catch a lot of backlash from those people within the community. But Khadijah, any closing remarks? Because I know we're zooming down to our time frame.
And how you just showed up, so I was like, oh, we gotta go. No, I'm good. I'm good. It's time up. Thank you, Bryan, for conversing. I love conversing with you. So thank you. And thank you, Heidi, for having us here.
Thank you, Heidi.
Thank you, Bryan. Great. Well, I want to introduce everyone to our final pair for today. Naimah O'Neal is a social worker at Circle Health Services in Cleveland and formerly served at the AIDS Task Force of Greater Cleveland. She is an effective spokesperson and advocate with an unwavering commitment to raise awareness about HIV and AIDS, and she has been doing that work for the past 11 years. Naimah will be talking with her pastor, Pastor Michele Humphrey, a licensed and ordained minister who has served as the pastor of Imani United Church of Christ located in Euclid, Ohio for over a decade. Pastor Humphrey is known for ministering on tough topics such as domestic violence, sexual abuse, abuse of power in leadership, issues that affect the Black community, and empowering messages that challenge listeners to move beyond mediocrity and complacency in order to live an empowered life through Jesus Christ. She holds a Master of Arts degree from Ashland Theological Seminary and a Christian ministry and diploma of theology in Black church studies from McCreary Center for African American Religious Studies. So please join me in welcoming Naimah and Pastor Michele.
Hey, good afternoon, everyone, because I think it's afternoon now. Hey, Pastor, you finally got on, I see.
I finally made it on. Thank you.
So I don't know. I guess I can start. I've been a member of Imani Church for, I think I've lost count of the years, and I think that being a part of Imani Church allowed me to be the person that I am today, because they were a big, huge part of my journey of acceptance. So I guess I just wanted to maybe start off. Do you want to ask me a question, or do you want me to go first? It doesn't matter to me.
Yes, I'll start off. You just said that, part of your faith journey. And I would like to ask the question, how did your faith impact you with living with HIV. Because we do know that for many people, the church was a place of pain, that many people ran from the church versus to the church. But your situation is different. You came to us, you informed the church of your diagnosis, the pastor at that time, and we would like to hear your journey. How was that for you?
Well, I guess mine was a little different from some of the other speakers. I was pregnant when I found out that I was HIV positive. And so my focus was mainly more on my child. And I had another little 2-year-old at the time as well. So my struggle was, how was I going to take care of them? No one in my household and my family, although they were supportive, they didn't understand my journey at all. So I knew someone who had went to Amani, who I had met at a women's group. And so I started visiting Amani, and I really liked the pastor at the time, who was Pastor Norwood, who actually baptized me. And so I had a journey of self-acceptance first. And so for years, I just really couldn't accept the fact that I was positive. I just thought that I was going to die in maybe 3 years. And so my goal was trying to make sure who was going to take care of my kids once I was gone. And so 3 years later, even though I was in and out of church, because I wasn't fully engaged at first, because I still had that issue of self-acceptance of myself. Because once I realized that I was positive and I wasn't going anywhere, then I had to figure out what was next. And so if I felt this way, I felt other women also felt this way too. And so I went on this journey of trying to understand what it means. And once you share something, you have you don't know how people are going to receive it. But once I gained some self-acceptance, I really didn't care how people felt. You either were going to be in my corner or you weren't. And I have this thing of, people are in your life for a reason and a season. And my church has been in my life for a reason. And they're still in my life because I'm part of that reason. And my faith has grown. And so even though it was a journey, and you always meet people who don't accept you, but that's their choice. And so I had to realize that it's not whether they have acceptance of me, it's whether I have acceptance of myself. And also I became selective on what can you do for me. So part of me was this, I needed to get fed, and if you weren't feeding me, then I had to move somewhere else. And if you gave me something, then I would take it, and maybe our journey would end right there, whatever that was. And so it's been long, and it's continuing, because as long as you get up in the morning, there's always something that you need to do, and you have to figure out what that is. And so I became a social worker because I knew that I needed to help people, and that was my passion, to help people. And I believe that that's my journey in life, that is my calling, to help others and to make sure that people understand. And living with HIV, even though it's 30 years or 30 plus years into this epidemic, people still don't have basic education. People still don't understand that there's only certain ways that you can get the virus, and that I can't do anything to you just by sitting next to you. And so I think I'm rambling, but it's been a journey. My church has been a huge part of that journey, because a lot of people have accepted me just for being me. The HIV part of it doesn't matter, because we are family, and I feel that love from my Imani church family. I really do. And I know that other people have not had the acceptance from the church, but I did a lot of, I did witnessing. I traveled a lot of journeys to get to where I am now in my faith. So I didn't start out being Christian. I started out being Muslim. And then I moved from that. I went to study with the Jehovah's Witnesses. I don't know what journey I was on with that. But, and then I ended up at Amani doorsteps, and I don't never plan on leaving until I leave. So.
All right. Amen. Well, first of all, I'm grateful and thankful that the Lord led you to Imani Church, because it takes people like you, Naimah, who are willing to share their story. And I know that there's risk in sharing your story, your experience, and your journey, because you will get people who not only don't understand, but those who are not trying to understand. You know, when it comes to the topics of sex in the Black church, it is still a taboo subject, despite the fact that there's LBGT in the church, despite the fact that saved, sanctified, Holy Ghost filled people have sex, singles have sex in the church. No one wants to talk about anything that deals with the whole issue of sex and sexuality in the church, although it impacts all of our lives in one way or another. And the fact that, people are not having quote unquote protected sex. Imani Church has a high population of single parenting, not always because of divorce. I have counseled many women who were contemplating on whether or not to have a baby, to have an abortion rather. I've counseled people who struggled with their sexual identity. And so these are real life issues that people face every day. And the fact that, some of these issues I haven't necessarily dealt with personally, as a pastor, it's my responsibility to open myself up to be able to minister to people where they are. And so I value stories. I love listening to people. I love creating those opportunities for people to share, because that's how we learn, that's how we grow. And when I think about the ministry of Jesus Christ, Jesus would eat with the quote unquote sinners, the tax collectors. Jesus would hang around the people that the quote unquote church folks or the Jewish people did not want to be around. He would spend time with the quote unquote rejected ones, with the lepers, with the prostitutes. And, I've always wondered, why were people so drawn to Jesus? And why are people today still drawn to Jesus, but they're not drawn to the church? We've heard the saying, I love Jesus, I just can't stand the church. And I believe it's because of his love for all people, all humanity, that was evidenced not simply in his sacrifice on the cross for humanity, for all people, but the fact that he loved. How do we know that he loved people? Because he took the time to minister to their souls and to heal them, to heal their bodies, to heal their minds. And that's what ministry is supposed to be about. To be a ministry, we're supposed to not only love the Lord with our heart, soul, mind, and strength, but to love our neighbor as ourselves. And so that means we have to have real, open, honest, conversation and dialogue around tough topics. And as a pastor, it can be difficult to have some of these conversations because you have so many people on, at different extremes. We are of the United Church of Christ denomination, yet we have very conservative and we have very liberal. And so we try to have different opportunities in which we can have guests come in, or we can have conversations around a topic. And Naimah, you are one. You and another one of our members, the two of you help me and help many of our church to gain greater understanding of what it is to live with HIV or AIDS, and to deal with our own biases, and to deal with just help us to see where we fall short in the way we judge or misjudge people. So, as the church, we have to continue to have conversations, but you have to have the right people at the table, and we have to be willing to listen. And Christianity is a ministry of healing. That's what Jesus did. He spoke, he preached, and he healed. And so health is important to him. Health care is important to him. Mental stability is important to him. And so the Lord wants you whole, Naimah. The Lord wants you whole. The Lord wants all of us whole. And who are we to say who can come to the church, who can't come to the church? Yet we do know there are doors that are closed. But I believe we are moving forward because of people like you, and then those pastors who are willing to have those tough conversations despite how the congregation may or may not react or respond. And so thank you for bringing, speaking to me, sending me emails, letting me know what's going on, what's happening, because if it wasn't for you, there are things I may not even have knowledge or understanding of. But, you again help me to understand more and more what it's like to live with HIV, the criminalization of those with HIV when you don't reveal your status, all of those things. And it is a social justice issue. And so I'm hoping that there will be more who will be willing to have those conversations and to not, to hide or to run from the church, because you have a right to be in the community of faith.
So I guess you talked a little bit about the church's role. So can you kind of maybe talk a little bit more about either the lessons that the church can learn from the HIV pandemic or and now COVID, and also, what part do you think the church plays in this whole pandemic? What should the church be doing to assist people living with HIV, and then now assist people with COVID, because COVID seems to be a little bit of a different animal and is causing people to be isolated the way HIV caused people to be isolated. And so now you have people living with HIV, and now in this pandemic, they're also isolated. So what do you think the church's role in that whole conversation?
To speak up and speak out. If the church is guilty of anything, is guilty of silence. Sometimes we have this mentality, I see nothing, I hear nothing. We try to be or remain ignorant as to what's going on in our world, yet, people are looking to the religious leaders to speak up and to speak out and to make a stance for those who may not have a voice. And so in regards to HIV, we've had testing at Imani Church on numerous occasions. Thank you for bringing HIV testing to Imani Church. And then having conversations again about sexuality and asking, everyone to be tested. And that means my husband and I would be tested along with the congregation, letting people know the numerous ways that one can contract the virus, whether you're straight or LBGT. And so again, preaching, teaching from the pulpit, being an example. In regards to this whole issue of COVID, I'm grateful to be connected to GCC, Greater Cleveland Congregations. And right now, one of the things that GCC has done was, again, to bring testing to the communities, realizing that everyone cannot get to a hospital to be tested because everyone doesn't necessarily have transportation in urban communities or in low-income communities. Also writing to CEOs of pharmacies in our neighborhoods, such as CVS and Walgreens and Rite Aid, and asking them to bring free testing to their stores so that people, again, because of lack of transportation, can be able to go into a Rite Aid or a Walgreens and be tested. We also know when it comes to COVID, you know, the number of African Americans that are being tested positive has to do with the fact that many cannot afford to isolate themselves or do not have the job where they can work from home, because we're not only the first responders, you know, we are nurses, but we're also working in the grocery stores, and we're working in the factories and in the warehouses. And oftentimes, you know, people not wanting to be tested because, you know, if they are positive, they know that they're going to miss income that is needed for the family. And so trying to work and collaborate with other organizations and making it known that we've got to do something. We need to be able to make sure that we have resources or monies available, that people are not going to be evicted from their household, that they're going to have food for their children should they test positive and have to take off 2 weeks from work. And so that's where clergy come in, that's where pastors come in. And so, you know, having conversations, having these webinars, having these conferences, and putting the information out there and seeking to hold our leaders accountable, letting them know what is acceptable and what is unacceptable. And then again, holding them accountable. And so the church needs to do more. I will admit we need to do much more, but also understanding is that we need people working alongside of us as well, helping us to stay educated and making sure that we are connecting and collaborating with the right people and with the right organizations.
I remember when you shut the church down. Huh?
Yes. Yes.
I remember when you shut the church down for 3. We used to have 3 services, and so every service, instead of coming and getting a lecture from you or a preached word from you, they got education on HIV and AIDS. I was so impressed by that, because I've never seen a pastor who would be willing to step aside to allow something else to occur in their church, knowing that sometimes when you say you're going to have an HIV or AIDS program, no one shows up because they think it's not them. But because you had 3 services where we had education in all 3 services, more people got tested, I believe, and also people realize that maybe it may not be for me, but it could be for somebody in my family. So the education is still important regardless of whether I accept it or not. Just being aware of what's going on. I was really very, very impressed by that. And so I also know that that it does take a lot of people, and I also know that people who are living with HIV like myself may not want to do the work that I do, and that's okay, because I think that teaching people living with HIV that you can do something. You may not be in the forefront of this, you may not be out sharing your status, but when you hear misinformation about education around HIV and AIDS, you correct people, or you offer the right education. I know that some people may not want to speak or even share their status. I remember the first time I shared my status was at a fashion show, and my daughter heard that I was positive. And so having that conversation with her to teach her how to protect herself, and I always shared mommy's status, was an issue with me too. So I am just thankful, I can't say that more than enough, for the journey that my church is going along with me, because you are journeying with me. And the more that I learn and the more that I come back and share, hopefully will benefit people in the congregation. So I don't want to go over our time, because I heard that little ding thing, so I'm not sure how much longer we have. But I really appreciate you being my partner in this journey. So thank you very much.
I love you. We're on this journey together.
Any final thoughts you'd like to share, Pastor Michele, before we turn it over to Q&A?
No, this has been great. I'm sorry that I missed the first part of it, There need to be more forums, there need to be more discussion. And the fact that we are really virtual right now, I think is a great opportunity to let people know, rather educate people on HIV and AIDS. Impacts all of us one way or another.
Thank you. Well, if I would like to call all our panelists back. So panelists, if you wouldn't mind, put your videos back on again. We're getting some great questions, and I will share these questions with you all. And if they're not directed to anyone in particular, I welcome any of you to jump in and respond as you would like. The first question is from James, Reverend James. How does the stigma affect BIPOC populations who are dealing with HIV and AIDS? Would anyone like to speak to that?
Could you clarify that acronym?
Yeah, thank you.
Black, Indigenous, people of color.
Well, I can take a stab at it. I think, like I stated earlier, stigma affects not just HIV and AIDS, but so many other facets and walks of life. And for me, I find the stigma is more prevalent in the intersections of HIV and AIDS. As a Black person, not necessarily an Indigenous Black person, I find that there's stigma in the intersections. So as we probably will relate to Indigenous people, I think there's a certain stigma that we as Black people may have against Black Indigenous people, because we all have our isms, and there's so many different isms. So whether you're here, wherever you originate from, or where you're from, I think we hold stigmas against each other from that. And I can only parallel it to Islam. We have this stigma, if you're an American Muslim, that you somehow are not Muslim. You have to be from the Middle East. And in the same vein, a lot of people think that if you're a Muslim, that you are a part of a jihad type thing, and you're a part of Al Qaeda. So I'm sure that parallels into was it BIPOC? Was that the acronym? It parallels into that acronym about. Okay, yeah, I'm just, sometimes those questions throw you off. So I'm just gonna step back, because we're all strong advocates and have all strong voices and people of faith, so we can go on and on. So I'll step back. Thank you.
Thank you. Anyone else want to weigh in on that one?
Just briefly, it's Vanessa, just that in addition to what Bryan said, is that since the beginning of the epidemic, this epidemic has disproportionately impacted the populations that are listed in the acronym. And nothing has changed, although we have life-saving diseases, life-saving drugs, and the drugs are saving a lot of lives. People in these communities are still prematurely dying, and they still do have the least access to care. That's what I will say.
Thank you.
You're welcome.
Shelley asks, when working with faith-based organizations, are you able to promote prevention programs or distribute condoms?
I like to, it depends on the church. I know that some churches you've gone into, my church probably, we've never had the conversation about condoms, so we won't talk about that right now. But being able to bring testing in, being able to bring that education in is good. Some churches don't even want that. So it depends on the church and talking to the pastor and how receptive the pastor is. I know when I worked at a church, the pastor was on board with testing, but the church was not. And so then it became this confrontation between the church and the pastor. So eventually, slowly, the church crept in and the HIV ministry went out the door to where I don't even know if they do anything right now. So it depends on how accepting the church is around the conversation. But any little tidbit that you can put in, the more you do it, maybe the next time you could do more, or the next time you could do something else till they build up to the level of where they're comfortable. Because people are just not comfortable with having a conversation. I don't understand why, but they really aren't.
And to piggyback on Naimah, it depends on the mosque or the masjid. In regards to testing education, a lot of people say, oh no, we don't need that, it doesn't affect us. Or, oh no, people won't come because it's not like a high priority type of thing. So we had to come creative. If they had like health fairs, would come in and have a table as part of the health fair. So they're coming in ready for blood pressure screenings and all that. They will have a table on HIV education. And I thought, oh, what's this? Learn more about it. We've had events where we do workshops, and some of the mosques have been very, very supportive. Like the one Bryan and I went to last year, they're very, very supportive of our work. The mini programs there, even the elders are like pushing people to get tested. So we'll have educational program to have testing downstairs, people come get tested. So it all depends on the community, and usually people that throw it as the most are people are part of the BIPOC community, especially the Black community. It's much better than someone from, like, let's say, the Arab community or South Asian community. Because, I mean, as you look at numbers, it does affect us more than other communities, but still, I've met people who are South Asian that are positive, people who are Arab that are positive, so Latino, so it affects everybody. But I think a lot of us are still in denial. And when it comes to condoms, no. But one thing we've done was we use like black bags. And inside we had condoms, we had lube, we had little messages and information. So when we have our table, people just grab them. And some of the youth knew what they were. Oh, make one of them bags real quick. Let's say to us and grab one. So people know what it is, but people wouldn't. But people who knew would grab some and take them like discreetly because they needed it. So it all depends on the environment and the community.
Khadijah is such a creative and innovative leader, and the kinds of things that she's working on is really important for people to hear and listen to, because in a variety of faith settings, the kinds of strategies that Khadijah is talking about are helpful and they work. My view is
Reverend Mike, I think we've lost your audio. Still cannot hear you.
Is it working now?
We got you.
Okay, I just had to click on my mic again. Sorry. But anyway, what I was trying to get at is that it's just important to be an advocate. So it's important for community organizations to be engaging with faith organizations, and for faith organizations to be engaging with community organizations, because through those relationships, you discover what is possible. Oftentimes, as Khadijah suggested, it's a matter of discretion. So there are even, I think, Catholic priests, you wouldn't hear me say this really, but who in their offices have a bag of condoms, and when they're in a pastoral setting might offer that to somebody. Nobody knows about that, but that's there because they know the health thing is important. It's off the record. I'm not saying anything that's particularly scandalous, but those kinds of things happen. But there are places, for example, even in the United Church of Christ and other places, where we actually have condoms out on the table in the narthex or the lobby of the church, where people can easily access them there. So there are ranges of responses that faith-based settings are able to do. What I think is helpful, and we find this in the framework for dialogue, is that when people hear the evidence, when they hear about what kind of interventions might be possible, they are able to figure out what can work for them in their setting, and we can work together to support. And when people are doing things that are more cutting edge for them, when they're part of a collegial group that is supportive, it gives them license to be able to try things and know that they're going to get some support for it. If they feel like they're isolated and on their own as a leader, it may be more difficult for them to take more of those forward cutting edge kinds of decisions. So helping leaders find collegiality with each other is one of the key strategies for helping people to be able to offer more prevention services to people living with HIV, and also to be more effective in addressing stigma related to COVID-19.
I'd like to piggyback off something. I do know that I do a lot of outreach at churches, and another way around it is you don't have to necessarily provide the condoms during service. We put condoms in food bags at the food pantries. Garden Valley first started doing that, and I saw that, and it was very controversial because a lot of people who were over the food centers said, "Oh no, you can't do that." But Garden Valley is its own kind of animal that has different populations that they reach. So we started putting them in food bags, and people welcomed it. A lot of times, people didn't know it was in there. And so they either gave them a chance to have a conversation because the literature was in there also, but it also gave them a form of protection to the point where they started asking for them. So that's another way that you can put it into your food bags if you have a food pantry at your faith center or whatever, your church. And so that's another innovative way to start having that conversation about condoms and HIV.
Great, thank you all. Such great strategies and insights. Appreciate it. Julie has asked, what can we learn from HIV to help prevent the stigma against faith communities in COVID? It seems like churches are being portrayed as super spreader environments and not necessarily being recognized as community supports. And so it sounds like she's asking, you know, as we're engaging this conversation around the similarities between COVID-19 and the HIV epidemic, how can churches be community supports in a helpful way in these moments?
One comment. I think by saying the church is not necessarily a physical thing, a physical building. The church is wherever you are. I think the Christian thing would want 2 or more gathered or something like that. I think if we get away from trying to victimize churches and the actual physical building and get away from that and get into a physical and spiritual community, I think we start to are able to have real more relevant conversations.
And then again, pastors have to be educated. We have to read the reports. We need to know the facts. We do know that, you know, the senior population and those with underlying health issues are vulnerable to COVID-19. And so pastors have to make decisions on whether or not we are going to have worship service. I lost my minister of music, not my minister of music, but my worship leader died of COVID-19. And so making decisions on, is it more important to be gathered or is it more important to be safe? And realizing, again, as he said, you know, as it was stated, you know, where 2 or 3 are gathered, there I am in the midst. That means we had to rethink, what does it mean to be the church? And we can worship, you know, we can gather virtually. We could turn our homes into a sanctuary. So again, being educated and then reimagining, re-envisioning ministry and staying attuned and abreast as to what is happening in our world. The church has to set an example and we have to keep people safe. And one way we do it is keeping people apart from now. It doesn't mean that we don't trust God, because even when we shut our doors of the church ministry continued, but we still faced judgment, that we weren't spirit-filled, that we don't believe in the power of God to heal people. Well, God is going to heal us in isolation as we, you know, avoid these public gatherings. So again, pastors, period, regardless of the topic, we have to be informed. As I was taught in seminary, always have your Bible in one hand. You've always got to have a newspaper. You have to know what's happening within the culture. And you have to be educated all around.
I would just add, thank you for that, Pastor. I would also just add the greatest public health service that church leaders can do is wear a mask to show the congregation and to show the public that they really are paying attention to the public health messages. So even if they decide to gather, which I really firmly believe in what you just said, Pastor, is that if the incidence is too high or the prevalence is too high in your area, you need to rethink that. But if you have to wear a mask, there's too many times they show folks in worship who don't have masks on. just too many times.
Great, thank you all. For all of our attendees, if you have any last minute questions, please feel free to put those in the chat box or the Q&A. We just have time for just a couple of more. And I also want to invite all of our panelists, if you haven't already, if you've mentioned your organization or another organization, please feel free to put those resources, links into the chat box for all of our attendees to gain from as well, if you hadn't had a chance to do that yet. Paula has left a nice little message here for each of you, as well as a great question. She says, thanks to the faith leaders for your heart to support those who are suffering from stigma in our faith communities. And then to those who are willing to tell their stories of pain and fear to help others to understand better the damage of stigma, thank you as well. A faith leader I know recently said that COVID has caused HIPAA to fly out the window. What are your thoughts regarding disclosure and privacy in relation to COVID and HIV and AIDS?
That is a tough one. As far as I know, HIPAA is still on the books. So anybody violating that, they're going to be in trouble. I get what the questioner is asking. For HIV, we are still well protected. And so I would look, if you want to do some advocacy around COVID, to look at some of the HIV confidentiality laws and model some of those, which we probably are going to need, because stigma is alive and well among COVID folks. So yeah, I would look at those laws and see what we can do to protect people who have COVID-19. They should have the same protections as anyone else who has a public health condition. That's my view. Thank you.
Well, I would like to say that it's such a scary time, and a lot of things parallel the HIV and AIDS epidemic, but can never reach the magnitude because I'm personally have went through the HIV and AIDS stigma. But I think it's never okay to share someone's status. And a lot of times we justify it, that, oh, we come up with all these reasons. And I don't like using the term disclosure. And when it comes to HIV and AIDS, I prefer to say share your status, because it's yours to share. Disclosure, the word disclosure means secret or new information. So that's also stigmatizing. So if you say share your status, but it's never okay to share another person's status about HIV, COVID, or any other STI, or any other issue that may impact them, because we've got to look at the acceptance piece for people. We all grow with understanding and acceptance in our own time. So we've got to allow each person to grow into that comfortable space of acceptance, because just because someone tells you you have a diagnosis of anything doesn't necessarily mean you understand it, know how to work through it, and have accepted it in your being.
Great. Well, I want to invite any of our panelists, if there's anything final any of you would like to say. We'd love to hear from you one last time. And so I'll leave the floor open for just a second, and then we'll pass it back over to Kim to close us out.
I'll keep watching the chat for a moment. Oh, go ahead. Go ahead, Bryan.
I think this is a great, I think this is a great start to a conversation. I know people on the call have already started conversations with churches and have been involved in actively trying to engage the church. So I know that that's already started for some people, but I think that more pastors need to be on this conversation. More people who have congregations should be hearing this message and trying to see where they can fit in. Not everybody's going to fit in the way that they would like, but starting the process, I think, is the most important thing. Even if it's just your congregation and you never go into the community, you never know who's in your congregation that will reach your community with the information that you provide for them. So I think this is a great dialogue, and hopefully we can have it more often if we're really trying to change the landscape of HIV in terms of healing people living with, preventing people from becoming infected, and then, or I'm sorry, I didn't mean to say infected, Brian, that was the wrong word, acquiring the virus, but to also educate people so that we can end the virus, because there can be an end to people acquiring the virus. We just need to take the time to figure out where we fit in and what we need to engage in.
Well, I think you did a great job. You self-check. I think a lot of times, it took me a lot of time to self-check myself. And I think that's important for people. Everybody's not going to get it, but if we give you enough information that when you're out on your own and you hear you say something, you step back and self-check yourself and then help to disband stigma wherever you may see it. And you'll be surprised how, you know, we all come a long way. So
I feel that over the past number of years that the church in many respects and many faith communities beyond Christianity as well have grown silent about HIV and the way in which HIV impacts communities. I think that a lot of complacency has happened because people have felt that because of the medications that we have, that HIV is no longer the health threat that it once was. But it is a health threat. It continues to be, and people's lives are impacted by that. And I do think, though, that COVID has presented us with new opportunities, because most of us who have been working in HIV are the same folks who are working on COVID. And so we can take advantage of this opportunity to address how we work on pandemics, and also how we listen to the communities who are most impacted, and how we address the disparities that are drivers of the pandemic, and how we as faith communities can use our values and our ministries to make a significant impact for healing in the world. And that's our task, that's our work, that's what we have before us to do. And I appreciate all of the folks who are on here for the love and compassion that they show and share, and for their solidarity and support and collegiality and collaboration in the work.
Well, thank you all for sharing your stories, your insights. I've learned a lot. I'm sure all of our attendees have as well. And I hope to put some of these new things into practice in my own life and work. Kim, will you close us out?
Yeah, I have shared the link for our evaluation. We'd love to have you give us some feedback on how we did. Also, if you're looking for CEUs, the quiz and the evaluation need to be completed for that. It is a 2 to 3 week process, so be patient with us. And thank you to Caracol in Cincinnati for being the organization that's offering those CEUs. And I put the link for our archives if you're interested in any of our older webinars, and where you'll see our upcoming webinars also. Thank you, everyone. Really appreciate it. This was amazing.
Thank you all.
Bye.
thank you.
Bye, everybody.
I will be holding it open a little bit longer so people can grab the link.